Many times we all wonder that do we actually need professional help for our emotional or psychological difficulties? This is indeed a difficult question which requires a lot of thought. But there are a few markers that one can keep in mind. In general, as far as the symptoms of various disorders are concerned, which includes anxiety, depression, obsessions, and other things like stress, these are fairly common and we all tend to experience them in some quantity or another. In fact, we all are somewhere on a continuum. Someone would feel more anxious, someone would feel a little anxious, someone would feel lesser anxious. So we all are on a continuum. But then how to decide that you need to see a mental health professional? As I said, there are a few markers to it. Firstly, you should try and evaluate that how incapacitating your symptoms are. Do your symptoms create a difficulty in achieving your goals? Whether that's studies, whether that's your career, or whether that is anything else, or whether that's being with other people, going out, enjoying, partying. Do your symptoms create a dysfunction in your personal life, in your social life, in your occupational life? If they do that, then maybe you need to see a mental health professional. Also, there are certain times when we don't feel any problem with our own selves, but there are so many people in our lives who tell us that because of you I'm facing difficulty. If you feel that there are more than 2 or 3 people who keep on coming back to you with these complaints, and you still feel that maybe there is no problem with you, but in that case, just pay heed to it and try and get your condition evaluated by a mental health professional. Because many times there are certain things and certain parts of our own selves which we cannot see or which we cannot feel, but they manifest in our relationships and they create distress for other people around. After you have sort of made up your mind that you want to see a mental health professional, you have a wide variety of choices. You could go to, but in a way you could go to broadly 2 kinds of professionals. One is a psychiatrist and another is a psychologist. A psychiatrist is one who basically sees the problem as biologically oriented, that there are certain abnormalities in the brain neurotransmitter imbalances and they try to correct these by the use of medicines. A psychologist, on the other hand, sees these problems as problems in interpersonal relationships and problems with the way you think, with the way you feel and the way you act. A psychologist would typically see your problems in your entire life context in relation to your personality and then try to help you out. And another marker to sort of evaluate whether your behavior is abnormal or not is to see that whether it differs markedly from the socio-cultural norms, from the people who are of your own age, and it differs markedly in a negative way. Because there are certain times and there are certain behaviors which differ from the normal mainstream, but which nevertheless are very creative and they contribute to the growth of society.